Welcome to today's lecture on diabetic nephropathy. In this comprehensive session, we will delve into the intricacies of this complex disease, focusing on various topics that will equip you with a deep understanding of its pathogenesis, clinical manifestations, and management. Our aim is to provide you with the knowledge and skills necessary to recognize, diagnose, and effectively manage patients with diabetic nephropathy. Our journey begins with an exploration of the role of podocytes, specialized cells in the glomerulus, in the pathogenesis of diabetic nephropathy. These fascinating cells play a crucial role in maintaining the integrity of the glomerular filtration barrier. However, in diabetic patients, podocyte dysfunction occurs, leading to the development and progression of kidney damage. We will delve into the mechanisms underlying podocyte dysfunction, such as oxidative stress, inflammation, and alterations in cytoskeletal dynamics. Understanding these mechanisms will provide valuable insights into potential therapeutic targets for diabetic nephropathy. Moving forward, we will focus on the impact of diabetes on the renal tubules and interstitial tissue. The tubulo-interstitial region of the kidney, often overlooked in the pathogenesis of diabetic nephropathy, plays a significant role in renal injury. Structural and functional changes occur in these regions, including tubular atrophy, interstitial fibrosis, and inflammation. These changes contribute to the progressive decline in kidney function seen in diabetic nephropathy. We will explore the molecular mechanisms underlying tubulo-interstitial damage and its implications for disease management. Inflammatory processes play a pivotal role in the development and progression of diabetic nephropathy. In this topic, we will delve into the intricate network of cytokines, chemokines, and immune cells involved in promoting inflammation and tissue damage in the kidneys of diabetic patients. Understanding the inflammatory pathways will enhance your understanding of the mechanisms underlying diabetic nephropathy and aid in the development of novel anti-inflammatory therapeutic strategies. Autonomic neuropathy, a common complication of diabetes, can significantly impact kidney function in patients with diabetic nephropathy. This topic will explore the mechanisms by which autonomic neuropathy contributes to renal dysfunction. We will discuss the role of renal sympathetic innervation, alterations in tubular transport mechanisms, and the clinical implications of autonomic neuropathy on the management of diabetic nephropathy. Predicting the progression and prognosis of diabetic nephropathy is of utmost importance for effective patient management. Biomarkers play a vital role in assessing disease progression. We will study specific biomarkers, such as the urinary albumin to creatinine ratio and estimated glomerular filtration rate, and their value in predicting diabetic nephropathy progression. Understanding the role of renal biomarkers will assist in risk stratification and determining the optimal treatment approach for individual patients. The role of growth factors, particularly transforming growth factor beta, TGF-beta, in the pathogenesis of diabetic nephropathy is a topic of great interest. Growth factors contribute to the development of renal injury by promoting inflammation, fibrosis, and cellular proliferation. We will explore the intricate molecular mechanisms by which these growth factors contribute to kidney damage. Furthermore, we will discuss potential therapeutic approaches targeting the growth factor pathways to halt or reverse the progression of diabetic nephropathy. Genetic factors play a significant role in an individual's susceptibility to developing diabetic nephropathy. This topic will explore gene polymorphisms and genetic variants associated with an increased risk of kidney damage in diabetic patients. By understanding the genetic basis of diabetic nephropathy, we can identify at-risk individuals early on and implement personalized preventive measures and management strategies. Renal biopsy, a gold standard diagnostic tool, is sometimes necessary to evaluate the severity and progression of diabetic nephropathy. This topic will encompass the indications, technique, and histopathological findings of renal biopsy in diabetic patients. Understanding the role of renal biopsy in assessing diabetic nephropathy will aid clinicians in making informed treatment decisions. Not all patients with diabetic nephropathy present with significant proteinuria. This topic will explore the clinical implications of non-proteinuric renal involvement in diabetic patients, including diagnostic challenges, management considerations, and long-term outcomes. Recognizing the complexity of non-proteinuric diabetic nephropathy is crucial for appropriate patient management and preventing disease progression. Renal fibrosis, a hallmark of diabetic nephropathy, is the key contributor to the progressive decline in kidney function. We will delve into the molecular pathways and cellular mechanisms involved in the development and progression of renal fibrosis in diabetic patients. Understanding these mechanisms will pave the way for the development of novel therapeutic interventions targeting renal fibrosis. Advanced imaging techniques, such as magnetic resonance imaging, MRI, and positron emission tomography, PET, have revolutionized the assessment of renal structure and function in diabetic nephropathy. In this topic, We will explore the advantages and limitations of these non-invasive imaging modalities and their role in evaluating diabetic nephropathy. This knowledge will broaden your diagnostic armamentarium when managing patients with this complex disease. Preventive strategies and early detection are crucial in the management of diabetic nephropathy. We will emphasize the importance of lifestyle modifications, glucose control targets, and screening protocols for identifying individuals at risk or in the early stages of kidney damage. Implementing these strategies will delay disease progression and improve patient outcomes. In conclusion, understanding the complexities of diabetic nephropathy is crucial for future healthcare providers. Familiarizing oneself with topics such as podocytopathy, tubulointerstitial damage, inflammatory pathways, and genetics will enable better diagnosis, management, and prevention of this condition.